This Sunday, the CDC under fire.
We had all winter break to have this planned out, and here we are.
With cases spiking, hospitals overwhelmed.
And it's just been a lot of uncertainty, and I'm tired.
Air travel disrupted, widespread labor shortages, including teachers staying home.
I would just appreciate being able to work in an environment where at least the students are all PCR tested weekly.
Criticism is growing over the government's COVID response.
We have to reorient our goal so that we get into a manageable state and we can continue with our normal life while COVID's around.
My guests this morning, Doctors Ezekiel Emanuel and Céline Gounder, former members of President Biden's COVID Advisory Board, and Mayor Lori Lightfoot of Chicago, where schools are closed in a dispute with teachers over COVID.
From NBC News in Washington, the longest-running show in television history, this is Meet the Press with Chuck Todd.
Good Sunday morning. As we've said before, as COVID goes, so goes Joe Biden's presidency. And right now, COVID is a major health and political problem. A combination of new variants like Delta and Omicron and stubborn vaccine refusal among millions has led to an all-time high in cases. The 7-day average of confirmed cases has just blown past previous records, and that doesn't even begin to account for people who don't report results of at-home tests or who are asymptomatic. Hospitalizations are spiking as well, but the death rate so far has ticked up much more slowly, owing in part to what appears to be a less severe illness that is caused by Omicron. The public is in a different place, though, than it was a year ago, and the Biden administration is desperately trying to catch up. The CDC has offered confusing and at sometimes contradictory advice. The Supreme Court seems skeptical about the best tool in Biden's toolbox, the vaccine mandates. And stay-at-home guidelines and school closures have given us a feeling of a recurring nightmare. All of it adds up to a big political problem for the president, who pledged to restore confidence in the government's ability to competently handle this crisis.
The new normal is not going to be what it is now. It's going to be better.
President Biden, elected promising to shut down the virus.
The first step I will take will be to get control of the virus.
Now faces an unprecedented surge.
The largest influx of patients that we've ever taken care of.
Nearly 1 in 4 hospitals report a critical staffing shortage. At the Luminous Health Doctors Community Medical Center in Maryland, COVID cases are up 925% since Thanksgiving. 70% of the patients are unvaccinated.
It's very tough. A lot of times you just have to take a break, you cry, and you come back. And you do it all over again. As
Omicron spreads, it's already crippling schools, including in Chicago, where schools were canceled this week over an ongoing conflict with the teachers union.
I want my students to learn, I want my children to learn, but I also want us to stay safe.
We will not pay you to abandon your post and your children at a time when they and their families need us most.
Nationwide, flights have been canceled.
How are you feeling?
Angry because I was supposed to be home yesterday.
Mass transit disrupted. In Los Angeles, so many ambulance crews are out sick. Some COVID patients have been brought to the hospital by fire truck.
We're in the middle of a tsunami, and in that tsunami, there's a lot of things that are going to get wet that wouldn't in a normal wave.
President Biden is promising 500 million free at-home rapid test kits, but he has promised to fix testing for a year.
We're also expanding testing. We continue to work on making at-home testing available. We're committing $2 billion to purchase nearly 300 million rapid tests. Believe me, it's frustrating to me, but we're making improvements.
And though Mr. Biden promised to restore confidence in the CDC after the Trump White House manipulated public health guidance for political ends, the CDC is under fire for messaging confusion.
I'm very concerned about the CDC toeing the line of whether or not we're basing our guidelines on science.
On masking?
Once you are fully vaccinated, 2 weeks after your last dose, you can shed your mask.
The window for boosters?
For up to 6, 8, we don't, perhaps longer.
6 months, 5 months.
And most recently, a change to recommendations that people infected with the virus isolate for 5 days instead of 10 without a testing requirement.
That antigen test was actually not authorized for this purpose, and its information would not be useful.
People are getting concerned about why not test people at that time I myself feel that that's a reasonable thing to do.
Now, half a dozen former members of President Biden's COVID-19 Transition Advisory Board are calling for a new approach.
It does feel like a bit of a choose-your-own adventure.
And they argue the country needs a national strategy for a new normal, and for COVID testing, surveillance, vaccines, and therapeutics. And joining me now is Mayor Lori Lightfoot of Chicago. Chicago's public schools canceled classes this past week because of a dispute between the city and the teachers union over COVID safety measures. Mayor Lightfoot, welcome to Meet the Press.
It's my pleasure to be here.
So in some ways, what's happening in Chicago is an outsized version of what's happening in a lot of cities and a lot of communities. So let me start with this. Are kids going to be in school this week in Chicago?
Well, I'm doing everything I can to make sure that that happens. And to be clear, what the Chicago Teachers Union did was an illegal walkout. They abandoned their posts and they abandoned kids and their families. We are working diligently every single day at the bargaining table to narrow the differences and to get a deal done. My team has been working every single day. They're back at it again here Sunday. They were at it yesterday. And we can get a deal done if there's goodwill on both sides. But fundamentally, what we cannot do is abandon the science. We know that the safest place for kids to be is in-person learning in schools. And we've spent hundreds of millions of dollars to make our schools safe. They are safe. We've got the data to demonstrate that. We've got to get the teachers union to get real and get serious about getting back into in-person learning.
Look, I know you're making this demands. What leverage do you have? How can you force this to happen? Or are you a little bit at the whim of the teachers union?
Well, the leverage I think we have is that we've got the will of the people. Parents are outraged, and they are making their outrage known to the teachers union. This is a very different dynamic than ever before. We've got an enormous amount of parent activism. They are writing letters, emails, they are protesting, they're holding press conferences. This is an unprecedented level of parent activism, all in support of returning to in-person learning. And we know why. We live in a district where 70% or more of our kids qualify for free or reduced lunch, which means they live in households that are poor and working class, which also means that they live in households with single parents, mostly women of color, who have to work to be able to keep the home together. So this walkout by the teachers union, which is illegal, has had cascading negative ripple effects, not only on the students and their learning, their social emotional welfare, but also on the families themselves. It is making them have tenuous financial status because they have to work, but they also have to take care of their kids. This is an untenable situation and completely, utterly avoidable. So I'm going to be on the side of the parents, fighting every single day to get our kids back in school.
All right, so what do you do this week, though? The teachers union, they've sent you a proposal. Some of the things that the public school system has said no to include, for instance, a metric for when remote learning would be triggered. And do you think it should be, would you accept a school-by-school metric versus a district one? What do you think is a fair compromise here?
Well, we already sent them a school-based metric on Tuesday before they walked out, which they rejected without any response, just saying it's not good enough. So last night, my team turned around a point-by-point response that deals with school metrics, which deals with testing, and a number of the other things that, frankly, we don't have disagreement on. The biggest issues is remote testing, remote learning, which we categorically reject. We have set up and I think responded to many of their issues regarding testing. So I think we can get agreement there. We have put together a revised proposal for a school-by-school metric, which really mirrors what we've been doing, Chuck, all along this year. We haven't sat idly by and let COVID rage through our schools. When there's been a necessity to shut down a classroom or shut down a school to go to remote learning, we've done that. And what I think is really important is of the cases that we can tie to schools, it's 53 outbreaks. And an outbreak is defined as 2 or more. Our average is 2.5 kids in the school setting where we believe that they may be related to schools. So we're doing what we need to do. We're following the science. And what I won't do is allow the teachers union to politicize this surge or the pandemic in general. People are nervous. They are scared. We get that. But the thing to do is to lean in to the facts and the science and not abandon them in a panic.
There does seem to be reports that you are short of tests, or the school system's short of tests. The governor apparently made a request to the White House. I know the way the funding mechanism works, that you'd have to find the extra money. Is that going to happen? Are you working with the governor for more testing? Are you willing to sort of flood the zone even more with certain tests that may not be the same tests that the system is using now?
Yeah, we've been doing that all along, and I'm happy to report our public health director found additional tests this week, which we notified the union about, and we're immediately putting into action. The governor yesterday announced that he would sell us 350,000 additional tests. But what we need is the support of our school nurses, who the union has not allowed to be activated to help on the front lines with this fight. So if they're agreeing to support the school testing regime that we are willing to set up, we can get this done. But again, we need their cooperation and support, and not have them be on the sidelines being critical, throwing bombs. We need them in this fight with us.
Where do you find the extra staff, though, that's needed right now? Look, let's say you didn't have this dispute. You'd still have staff shortages. We're seeing it in schools all over the country. Is there a good plan to fill that gap? Or as a nation, do you think we should be pausing for a week or two?
No, I don't think we should be pausing. Again, we've got to follow the science, and the science tells us that the schools are safe and our kids learn best and are safest in person. What we're doing regarding staffing is providing even more incentives for substitute teachers. We're doing everything that we can to continue getting our staff healthy. And look, the reality is the teachers and the staff, we've got 92% of them that are vaccinated. So we've got a very highly vaccinated workforce. That, again, isn't the issue. We can't play into fears. We've got to deal with the science and the data and the reality. And yes, there's a lot of concern. There's a lot of concern about the spread. But if we work together collaboratively, we can address this issue.
Any chance?
No question.
Any chance that I've got to let you go, but any chance school opens tomorrow? Unlikely.
Well, we're working like the Dickens to make sure that we get a deal done today. So I remain hopeful.
All right, Mayor Lori Lightfoot of Chicago, Illinois. Madam Mayor, thanks for coming on Meet the Press.
Thank you, sir.
This week, 6 members of President Biden's COVID-19 Transition Advisory Board published opinion articles calling for the administration to take a new approach in fighting COVID. 2 of them are joining me now. Dr. Ezekiel Emanuel is the Vice Provost of Global Initiatives at the University of Pennsylvania. By the way, he's author of the book, Which Country Has the World's Best Health Care? And Dr. Céline Gounder is an infectious disease specialist and epidemiologist at the NYU Grossman School of Medicine and Bellevue Hospital in New York. Welcome to both of you. Zeke, I want to put up basically almost a bit of the thesis that you had here in these articles. You write this: without a strategic plan for the new normal with endemic COVID-19, more people in the U.S. will unnecessarily experience morbidity and mortality. Health inequities will widen and trillions will be lost from the U.S. economy. This time, the nation must learn and prepare effectively for the future. You guys are saying what others have been saying. This is not a pandemic anymore. It's an endemic. So what changes have to happen now? Zeke, you first.
Well, first, Chuck, I would say we're not yet in the endemic stage. We're still in the pandemic stage. If you've got 1,500 people a day dying from this disease, it's still a pandemic, and Omicron is spreading. We think that over the course of 2022, we will get to an endemic stage. And the plan is, or the proposal is, we need a strategic plan for that covers vaccines, getting more people vaccinated. And the only way to do that, as we've been very clear over time, is mandates. We got voluntarily to about 60%, but to get beyond that, we are going to need the employer mandate that OSHA's put out, the healthcare mandate that CMS has put out. We need to improve our ventilation system. We need to get more therapies and get the link between a positive test and getting a therapy much closer, so you can actually start in 3 days, and not only the rich and well-off get it. Those are the kinds of things we need to put in place over the next 3 months to be prepared when COVID is really just in the air, like RSV, another respiratory virus, like influenza, like adenovirus, all the respiratory viruses. It's going to be here. We're going to learn to live with it.
Dr. Gounder, should we be prepared that this is going to be a seasonal thing? Meaning, and frankly, we probably will have a yearly variance. Is that how our public health community has to face this?
Chuck, that may well be in our future, and how often we will need to vaccinate people, we are still not yet certain. I think this also really depends on what are the goals of our public health programs. Are we trying to prevent all infections and transmission? And to be clear, that's going to be exceedingly difficult, even with everybody vaccinated, because of the nature of this virus. This is a virus that has a very short incubation period. So unless you keep reboosting everybody every 4 to 6 months, you're not going to be able to prevent all infections. And so what we're really proposing is let's focus on what matters the most, hospitalizations and deaths. That's what we focus on for other respiratory illnesses like the flu, like RSV. How do we do a better job of preventing those hospitalizations, those deaths, particularly among the most vulnerable, so the elderly, people who are highly immunocompromised, people who are living in long-term care facilities, and of course, communities of color and others that have been highly vulnerable during this pandemic.
Zeke, you brought up the issue of mandates and how important it would be. I'm sure you have seen all the reports. At best, maybe the healthcare mandate makes it through the Supreme Court. The workplace one may not. What does that mean if the vaccine mandate is the best tool in the toolbox and you can't use it as aggressively in the federal level? Does that mean testing becomes a bigger priority?
Look, the Supreme Court has to recognize that COVID in the workplace is a real health threat and really does affect many people. And unfortunately, many frontline workers have died from COVID and contracting COVID in the workplace. They need protection, and mandating vaccination is a quite reasonable protection. I've called for 6 or 8 months now for mandates among healthcare workers. These are our best tools to get to 90% vaccinated. Testing lets us know who's infectious, but it doesn't intervene in the virus, whereas vaccines do intervene. They make sure that people who get infected don't get hospitalized at such a high rate and are very, very, very unlikely to die. That's an important protection for people, and we have to make sure that people get it. We will never get to 70, 80% or 90% of the American population vaccinated without a mandate. It's just that simple. And for the Supreme Court to take that away in the midst of an emergency seems to me to be very wrong. I signed on to an amicus brief because I think it's legal and I think it's absolutely vital for the health of the country.
Dr. Gounder, I want to talk about the CDC messaging issues and how much of this is on the CDC or how much of this is on the White House. Look, we've seen just in the month of December, I want to put up here, on December 20th, we were told to stay at home until after 10 days have passed since your positive viral test. A week later, people with COVID-19 should isolate for 5 days. No mention of whether you should test negative before getting out of that. Then on Tuesday, the best approach is to use an antigen test towards the end of a 5-day isolation period, says the CDC, although the CDC director 2 weeks ago sort of dismissed whether antigen tests are worthwhile there. How much of this is on the CDC and how much of this is on Washington, if you will?
Chuck, this is a great question. I think all of us could have done a much better job from the beginning of saying, look, the one and only thing you can count on is that the recommendations and guidelines are going to change over time. That is the one thing you can count on. But let's take this example of isolation policy. Yes, the CDC came out with rather confusing, in a sense, overly tailored advice, trying to please and fit its advice for every single possible setting, healthcare, schools, travel, the general public. So yes, the CDC could have done a better job, but there are many other parties that contributed to this issue. You have, first of all, the FDA, under both the Trump and Biden administrations, has really dragged its feet on authorizing these rapid antigen tests for the purpose of assessing are people contagious or not. Many of us have been advocating for that. They have yet to do that. We have real world evidence that the rapid antigen tests are a good measure of contagiousness, but the FDA has not authorized them for that purpose. And just like with vaccines, the FDA has to authorize, then the CDC makes recommendations about their use. Then you have the manufacturers, the private sector. They have not been manufacturing enough rapid tests. And the White House and the administration certainly could have done more earlier to work with the private sector to create a more stable demand by putting in large volume orders. And then finally, on the back end, you have the private sector, everyone from Walmart to healthcare systems that are willfully misinterpreting the CDC isolation guidance, saying, oh, well, now you have to go back to work at 5 days. That guidance is to indicate who is infectious, who's contagious, who's a threat to others, not when you're well enough to go back to work.
Very quickly, Zeke, are we ready for the next variant? We weren't ready for Omicron. Are we ready for the next one?
I think we have to prepare more and get better, get more vaccines out there, more tests, but also better air quality. People have to wear better masks and be more scrupulous about it. But if it's like Omicron, where we're not that infectious, I think that we can learn to live with it. And that's the important point.
Well,
learn to live with it.
Risk management. It seems like we all need a course in risk management there. Ezekiel Emanuel, Céline Gounder, thank you both for coming on.